Hello, everybody, and welcome to this week's edition of the AHA podcast. Welcome.
Hello.
Hello,
Hello.
hello. So,
Good
what a
morning.
crazy week. Did you guys get rested up from being on the road for a whole week and then some for you, Alyssa?
Yeah, somewhat. I had a good time at the Aetna National Distribution Partner Summit last week in DC, and that was a great meeting. And then had the weekend to relax, and then was in Orlando for the Florida NABIP Medicare Symposium. That wrapped up yesterday, so I got home. So now it's back to normal for a little
Ah,
while.
but the new normal. So, what were some of the highlights and takeaways from the Aetna meeting?
So their theme was strong, steady, ready. And I think that was something that we heard repeated quite a bit throughout the 2-day event. One of the things I think that I took away, and I'm looking at my notes because I was taking notes, but agents have a voice. Like they're really listening to agent feedback and partner feedback. So it sounds like they're really dedicated to agents and brokers. Clarity, calm, and consistent. They sent out the first looks now. So they're one of the earlier health plans that has done that. So it's not super detailed because, of course, things can still change. And putting my compliance hat on, we can't talk to beneficiaries about these new benefits until October 1st. So make sure you don't do that. Things could still change a little bit. But I feel like, they were just all about being consistent, keeping things as stable as possible for agents and for beneficiaries, I think is one of their main goals. And I wrote down race the run because one of their leaders told a great story about his Ironman experience, and race the run is a phrase that he used. And I thought that was great. I'm going to put that into my vocabulary now.
Yes, Jacqueline and I saw him actually at the Rayburn building after we got to talk with. Well, I'll let Jacqueline talk about that. Jennifer, any takeaways that you had from the Aetna event itself?
Yeah, I mean, I loved it. It's always great to get around the industry. There's other leaders from other distribution partners, and just to kind of be around in the same room and learn what's going on. We're all committed to being the voice of the independent agents in the field, and that's a mission that we can all take together back to the carriers and also to CMS, right? So I'm excited to hear about I know you guys had to peel off from the Aetna meetings just to go attend other meetings in DC and have some really good nuggets from that. So I think it's perfect segue into what you guys did.
Yeah, I'll let Jacqueline hit the highlights of that. But I will say, Jennifer, I talked with some of our counterparts out there who I respect, and they said the agent really should be viewed as the representative of the carrier. It's a big job the agent has, and I've thought a lot about how the agent and the FMO really serve the beneficiary in terms of being a safety net, and how they serve CMS, because CMS ultimately is strategic as much as they try to do tactical things. They really depend on us. But I think positioning the agent in the rightful position as the representative of the carrier, I thought that was a good industry move. So anyhow, Jacqueline, I mean, we couldn't have timed it any better if we planned, I think, 4 or 5 external meetings in addition to all the Aetna keynotes and all the Aetna, milestones. So talk us through some of that.
Yeah, absolutely. So it was great to be at the Aetna rollout event with this team and to see the Aetna team. So that's always fun. And they had a great event there in DC, and what a hub to be in the time. There's a lot of happening in DC that week too. So I think the stars aligned is what I say. And the people that we got to speak with, and a couple of the highlights there, I think Darwin is definitely the MedPAC meeting that we sat in on, and getting to speak with that team too, especially the analysts that get to write on the subject of agents and brokers and their report to Congress that they do a couple of times a year. So that was a really great and collaborative dialogue, I would say too. They're very open to listening. You shared a lot of great information with them too. We touched upon the quality metrics, and you could see that it really facilitated a great dialogue about more about our agents and what we do and the important work there. Also love seeing Mary Beth at BMA and their DC event. They had Alec Armanda over there too with CMS, and a couple of great panels. What was great about that too is, they were not only they were talking about a couple of important topics. One was is affordability. That seems to be a really hot topic right now, not only for plans, but also for CMS and of course our beneficiaries, because I think, with inflation and rising healthcare costs, it's an important topic. And there's a new study out by BMA on how there's less spending in the MA program for members too. So I encourage everybody to check that out. And they're doing a lot of great work on there, and really looking at what matters and is important too. But before I go into that, I know you were at those meetings too, Darwin. So anything that you wanted to share about that in your experience? I think some people think, MedPAC is sort of just this siloed wall, and they sort of just hear about this organization and the reports. But I think the experience went really well.
Yeah, I do have some thoughts, but there's one more. Why don't you finish the trifecta with HLC, and then I'll give my version of the three.
Yeah, absolutely. So the Healthcare Leadership Council is great. They do a lot of work in advocacy, especially for the Medicare Advantage program, which, we see organizations like Better Medicare Alliance do too. And they kind of touch upon, though, all subjects within healthcare, the Healthcare Leadership Council. And they had a Hill briefing at Rayburn last week. So there was John Brooks, the director for Center of Medicare, led a panel with former MedPAC chair too, Michael Chernow. And it was really great and informative too. So we got to listen to MedPAC twice in 1 week, the former chair, and then we got to meet their current team. And I think they, affordability and quality were a lot of the conversation points as well. It was great that we got to speak with John Brooks there too, and to have that dialogue with him as well. And I think there's, just an opportunity and a real eagerness for collaboration, that I was really encouraged to see that.
Yes. Well, I've got an ace in the hole that I got to talk about, but I'm going to save that towards the end. But in reverse order, so the John Brooks conversation and the panel with Michael Chernow, who's a very accomplished head of MedPAC, professor at Harvard. The dialogue that they had about the back and forth between traditional Medicare and Medicare Advantage was the single most enlightening conversation that I may have ever observed in my 21 years of Medicare Advantage, and maybe in my entire career. So really, they didn't necessarily get into a lot of the details, but the gist of it is that you get more benefits from Medicare Advantage. It's better care because it's coordinated, and it has, additional areas in it, acupuncture, chiropractic, dental, vision, hearing. And so the gist of it is that it's more expensive, right? And so perhaps $200 a month, more in benefits and perhaps more in expense. And so, where do we want to draw the line as a country? How much is too much? Have they overdone it on Medicare Advantage and maybe pull some of that back? That was the gist of it. And there was another gentleman there from California who ran an organization, and he was the most insightful because he said, 20 years ago, traditional Medicare was so horribly inefficient. There was just no coordination, and it was very piecemeal. And so Medicare Advantage was really easily, beating the outcomes that were provided there. But now original Medicare, traditional Medicare, whatever you want to call it, it's evolved, and there's been some innovations there. And he pointed out that, oral health is linked to other things. And so where we draw that. So I thought that was just the most powerful. I hope HLC puts that up on their website, because we'll certainly put a link there. But the one thing that I thought was absent in the wonderful dialogue is that they didn't put it in the beneficiary's perspective, right? So the way that I see it is that obviously people vote with their feet. Medicare Advantage is wildly successful, and there are significant benefits in the program beyond original Medicare. And the beneficiary pays less out of pocket than they would say for a supplement. And they have more benefits and better care. It's coordinated care, and it's got things that original Medicare doesn't have, and that, quite frankly, supplements don't have either when you add that to original Medicare. And they have a safety net. They have a maximum out of pocket, whatever that might be, which is more, less than traditional Medicare. And so now, do we want beneficiaries to have that much? Can we afford it? I know we want them to, but can the government afford it? What's the value? What's the bang for the buck? How many of those benefits are utilized? There's a lot of great questions in there. But the thing that I told MedPAC and that I would tell the world is that wherever they want to draw the line in the back and forth between the political, activities, between the budgeting activities, the safety net across the country that safeguards the beneficiary is that community-based broker. And the person that enables and supports that broker is the FMO. So wherever they want to draw the line, they certainly don't want to throw out the baby with the bathwater and start playing Jenga, with the budget of the broker or, ignore the chance for quality. The other big thing that we talked about to MedPAC proper, and they, again, as Jacqueline said, they were open for business like CMS. They were collaborative. It's just really refreshing. Whether they agree or don't agree with what we said, I could tell that they were engaged and they're actively seeking to be informed and make good decisions with that information. And the point there was that there isn't a proper rating system for brokers. So, you hear about star ratings. Everybody in the industry knows doctors, hospitals, health plans, nursing homes. I don't know that there's anybody in the industry that doesn't have a yardstick. I don't think any of the yardsticks are perfect. I think there's a lot of flaws in a lot of the rating systems and some hopeful improvements on the way. But writ large, other than, MA production or complaints to Medicare, there's not a proper rating system for the broker. And I think that's where the trick comes in. It's like, what does right look like? And how do we have a common yardstick across carriers to measure? And so I promoted that, got good feedback from carriers, several carriers now, and senior leadership too, starting with our account advisors and working our way up. So that's good. The government, John Brooks and I had a hallway conversation and he immediately understood. He didn't tip his hand one way or the other, so I don't want to overstate that. But in that dialogue, he understood that there's low performers and high performers, and that the high performers help the coordination, they help the system work better. And, he's open to a follow on. So really, if you think about some of the top people at CMS, Chris Klomp, John Brooks, and Dr. Oz, we're really getting a lot of traction. Now, of course, they've got staff folks that really get into the weeds, and there's non-political appointees that are more full-time across administration people. So there's a lot of people, to continue this dialogue with, but it's all very constructive. And then I'm gonna save my big event on Friday that I got to go to, but I want to pivot back to you, Jacqueline, and I just want a 1-minute overview, and I think next week we should talk about it. But I saw that the PDP trial was canceled, and there's some implications. That notification came out on the 28th, which is well after bids and things were filed for. So could you just give us some clip notes on what's at bay there, and then we'll dig into it next week?
Yeah, absolutely. So I know that's making headlines right now. Yesterday, CMS published an update stating that they're going to conclude the Part D premium stabilization demonstration by the end of contract year 2026. That was a voluntary program that a lot of PDPs entered. And the point of that was to help PDPs transition into the new IRA benefit design because they had to subsidize more of their costs. So rather than to see these big spikes in premiums for PDPs as a knee-jerk reaction, the demonstration program was supposed to help subsidize any of those things to see somewhat of a stability in PDPs, which, we know that kind of been more or less disruptive over the last couple of years. So that's supposed to end this year. CMS is saying that, pretty much carriers had about 2 years. I mean, the PDP plans had about 2 years of claims data to kind of understand how they're going to enter into bids. So we'll keep a lookout and provide updates along the way. But, the 2027 bids for these plans for PDPs were already in place without really fully knowing whether this program will continue. So I think, should be interesting, and we'll analyze the potential consequences of that and share that.
Okay, great. And then, Jennifer, we've seen a couple of cases now where agents have decided not to sell their book of business and to stay longer. We just had a recent series of activities where the end result was they like the industry and they like what they do. What are some of the reasons you're seeing that people are choosing not to sell? That's a capital NOT.
Well, I love this topic. I actually think we should do another podcast in the future about this. So I'll just say that, there's a lot of organizations out there right now that are using, venture capital, private equity money to try to get into this space, right? Because they see Medicare Advantage as a growing industry, right? We have 35 million people and growing on it, right? Is it almost 36 million now? So there's plenty of activity out there, people wanting to get in. And their way of getting in is there's a, new set of pop-up groups that are saying, hey, I'll buy your book of business. I'll give you a lump sum cash. I'll keep you on the books. I'll pay you a salary. And they're putting these big, paper tigers in front of them, telling them they should sell. So I am definitely a spokesperson on why not to sell your business. You're your own boss. You're an independent agent. You're doing great stuff in the community. There's no better way to make a great living and to bet on yourself. And your direct success is, equal to how hard you work. And so, and I would say that anybody that's coming to you with that is because they can't do it themselves and they want to get a piece of it, so they're smart with a calculator. And so, if anybody ever wants to talk about that or has any other questions, and maybe we'll talk about it on another podcast, I would love for you to hit me up on LinkedIn and send me a message. I will literally show you math models and tell you why. I would say as agents, maybe we're not as great with the calculator or the math problem, or we're better to be in front of seniors and helping with beneficiaries. And perhaps some of these venture capital money folks are really good in that way, but they're not good with beneficiaries. So anyway, that's what I would say there. And it's a big topic and it's important because at the end of the day, with the pressures on this industry and Medicare Advantage, every single stakeholder needs to do their part. We need to be able to invest as much as we can down to the beneficiary. And so that's where our focus should be. And I've always said over the last 20 years, if you do the right thing, the revenue follows. You don't have to come in and do all these crazy things. So anyway.
Well, so, of course I agree with everything you said, but let me push back on that a little bit. Like, why wouldn't I just take a bag full of cash today and go on down the road? Like, sounds good to me.
Yeah, for sure.
Fishing in the Bahamas.
I mean, if you just wanted to get out of the business, maybe, right? But I mean, you're going to make more money by keeping engaged in your own book of business than you are with the offers that are getting put on the table, is the bottom line. They make it look really sexy, right? Like, hey, I'm going to pay you this big amount of money in year one. But again, if you keep your business and just take the revenue that you'd make over the next 2, 3, 4 years, it's in some cases double or triple what they're offering you. Also, when you do get a big lump sum of money, depending on what state you live in, not only are you paying capital gains tax of something like 20%, you also could be paying state taxes and transaction fees. And then when you have that money, whatever's left, maybe 30% at that point is left in that first year, you got to put that money somewhere. And if you put it in the stock market, what, you're going to make like 8%, or you stick it in a money market, you're going to make what, 2 or 3%, or a CD.
I'm going to buy SpaceX.
You're going to make SpaceX. It goes down 30%. Yeah. Well, the thing is that if you do that, I mean, that's money
stocks are cheap now, right? Stocks are cheap,
right? So, I mean, that's the bottom
line.
They're
at record highs. I'm joking, right?
Yeah,
stocks
record
are
highs.
Record highs. So
yeah.
What's the stock market make over time historically? S&P
8%. The stock market makes 8% over time. But in some of these deals that they're offering people, they're saying, hey, we want you to grow by 15%. You can just grow, if you're going to grow by, and then it's 15% of the next new number the next year. If you just flat out make that same percent increase in your own business, you'll make more money investing in yourself in your own business than you're going to make by taking cash and trying to put it somewhere else. So that's
how much does my business grow in 5 years at 15% a year?
Oh my gosh, the math.
Let me get my calculator out.
Yeah.
It's a double.
It's a double. That's right.
The rule of 72.
The rule of 72. That's right. I've heard you say that.
72. So if you grow at 24%, you double in 3 years. If you grow at 15%, you double in 5. You grow at 10%, you double in 7. So they want you to, give them the cash flow today. And then they control the company today, and they take, the cash. And then in 5 years, your company's doubled. So if you like what you do, obviously, if you're sick or if you're just not able, I mean, there are legitimate reasons that you might want to do that. But if you like the Medicare Advantage business, we're going to go from 65 or so to 80 million people at 2030. things are going to be bumpy this year, but it'll stabilize. And then from 2030 to 2050, we're going to go from 80 to 100 million beneficiaries. So it's a wonderful market. The demographics are on our side. It's really one of the only feasible solutions with these chronic condition plans. And, the population's getting older, getting sicker faster. So, if you like that type of work, this is phenomenal. And you can control, like you said, Jennifer, you can control what you do every day. If I buy SpaceX stock, I can't really do much to make it go up or down. And Elon Musk isn't taking my phone calls asking me for advice lately. But with your own business, you can do that. And of course, the folks that are financially engineering and putting that together, that's their best option, right? That's the best use of their money. And when people wanted to buy Advocate, I was like, well, why do you want to buy Advocate? They're not giving me money because they like me. It's not a philanthropic thing. They're buying our company, or trying to, because it's the best use of their money. It's better than buying stock. It's better than buying real estate. And so, you can take the money out of your company. You can go buy stock with that money. You can go buy real estate with that money. But, there's not a lot of purpose in buying a stock. There's purpose in what we do. So we will change the format based on, our feedback from our customers and our audience to you. Maybe a little more focus. So we'll do a podcast on why not to sell your business. And we'll do one on, the PDP program and the implications for that trial ending and how that might impact your value proposition and what the carriers might do. Well, we're going to anticipate, we don't know factually what the carriers will do, but we can have an educated guess. And so now my big reveal is that on Friday, with a few other professionals in our industry, and thanks to Candace, who put this together and really got us in. We had a meeting with Dr. Oz. We were in Tampa at the little nice club they have there on Bayshore. And the gist of the meeting was Congresswoman Lee, who is a real go-getter. I would have said up and comer, but I think she's already up there. She was able to get Dr. Oz to stop by for a fireside chat. And so he talked with a group of 22 of us and 5 or 6 brokers in there. We had a good representation. And he really just laid down the big picture in a way that I haven't heard. I mean, I've watched almost all of his speeches that are publicly available. I've seen him in person, speak at the quality conferences. And he talked about that they're open for business. He talked about how many great things are happening. And he talked a lot about the fraud. It was amazing to hear, that other countries, like he mentioned that Cuba was involved in some fraud in Miami with the the durable medical equipment, and how they had got that. He talked about some organized crime in California and LA with the Alzheimer's facilities, and a huge percentage of all the facilities in the country were in not just in California, but in LA proper. And he talked about, keeping the money in the door and the things that they're doing there. So that was wonderful. I was able to have a bit of a sidebar with him, letting him know that we had been following up on quality. 2 years ago, he told us that he has some concerns about broker quality. And so we've let him and his team know that we've been addressing that. Jacqueline was able to have a hallway conversation with him last year, where he basically said, bless you, the work that we've been doing to coordinate with the carriers. And all the carriers now are putting quality metrics out there. I would hope that they would, use the same 5 that we talk about: accretion, rapid disenrollment, retention, complaints to plan, and complaints to Medicare. Because if they don't have those same 5, and they all have their own different 7, and they measure them different ways, we still won't be able to have apples to apples across carriers. So I just want CMS to encourage them. And again, we don't want laws to change. We don't want CMS to make more rules. We just want them to encourage the best practices. And we believe that's part of their oversight role as they manage those 170 or so carrier contracts, and that this could be a voluntary thing, and it's in everybody's best interest. So he was there. He's quite charismatic. He really knows how to move around the room. We got some great photo ops with him. He's just a great leader, and I'm proud to have somebody like him leading CMS, because I think he sets the tone for the environment, and he really brings people to the table to collaborate. And he said at least 3 times we're open for business. And by the way, he said that the majority of the tips they got on finding the fraudsters came from quality brokers like our audience and ourselves watching. So those tip lines, they follow up and they do something with it. And so with that, that was pretty big moment for me. Although I've done it before, not in such an intimate venue, and I thought we were well represented too. I thought that we had a lot of professional people there, and it wasn't just brokers, but there was a good concentration of folks that would do what we do, and so that was nice. So around the horn, starting with you, Alyssa. Let's go, Alyssa, Jacqueline, Jennifer. Final comments, final thoughts, and then we'll wrap it up.
And final thoughts for me, just attending Aetna, also being at NABIP this week in Florida, hearing from some Medicare brokers there and some carrier leadership that was also in attendance. I think everybody's craving the same thing, which is we want to see some stability, right? Like we felt like the rug was getting pulled out from under us last year a few times with commissions being cut, plans exiting markets. And I think across the board, everybody is looking forward to a reset and getting back on track and ultimately having something everywhere to be able to offer Medicare beneficiaries. We don't want any plan deserts. We don't want people to feel like they have to switch plans every AEP. So just that stability, I think, is really key from what I've taken away from the meetings that I've been to. And then, of course, in a couple weeks, I will be attending a few other big plan rollouts that we'll be attending. More to come there. So stay tuned. We will broadcast whatever information we can as soon as we can.
Jacqueline?
Yeah, I would say for, planning purposes too, I think right now a lot of agents are thinking about what's my communication strategy to my clients for ANOC and AEP, and we're helping to get that out there. And we'll have some really great email blasts out to our agents and teams this week with some resources. And one of the things that always inspires me with our agents is that they really care. They want to get a pulse and a feeling for what's going to happen because they're there to protect and educate their clients. So I'm always inspired by that. And so stay tuned for updates there. We'll be sharing good things.
Thank you, Jacqueline. Jennifer?
Yeah, so this is like an exciting time of the year for me. I enjoy this because we start hearing little nuggets of information from carriers. We try to I call it juicy nuggets. I have great conversations. I had a great conversation this morning with one of our top brokers, just talking through the strategy, getting ready. How are we going to go after the current members? Who needs to change if we hear about certain exits or whatnot, or what we need to do is just being ready for that. So again, there's going to be a little bit of disruption, but I think it's going to be a little bit more stable than last year. Certain parts of this country are going to be more crazy than others. So I'm just excited. I get really like butterflies leading up to AEP and when the race starts, and the sales start coming in. So it's really fun. And I love strategizing and talking about that and helping people and getting people ready. And to Jacqueline's point, we'll be able to help with a lot of those book of business communications alongside of those agents. And lastly, I'll just say that I believe we know that there are some sneak peeks coming out on Thursday around the afternoon, 2 or 3 p.m. for United Healthcare. So be looking for those emails coming from them on Thursday afternoon for some kind of a sneak peek. So
yeah, and then you've got United and Humana coming up in a couple of weeks, right?
Yeah, that's right. Yep.
Well, busy time. Yes, well, I too get butterflies. I like what we do. I like the meaning of it. I like who I do it with. I think it's just fantastic that we get to do this. It's a terrific value. My 2 comments are, number one, don't let your fears run away with you. I think it's human nature to, think the sky is falling when it's really just a little cloudy out. And, we've lived through a lot in this industry, but there isn't really, I think, a better alternative. And I think we're making what we have better and working together. And the other thing I'd say is, and this is sort of funny, but, people make laws, people make rules. I keep running against conversations that are like the rule says this and law says this, and they feel constrained by the law. But, the government is here to support the people, and we are on the front lines. You all, the listeners, are on the front lines. You hear what's working and what's not working, and we're a conduit. Your local congressman is a conduit. Be vocal with your conduit, with your congressman. Be vocal with us, because laws can be changed, rules can be changed, and there's nobody I've met that literally doesn't want to do good for the beneficiary. All the problems happen when people have different viewpoints about what's good, or someone thinks someone is behaving badly, which does happen. and then they're willing to maybe deal from the bottom of the deck and kind of an ends and a means thing. That's where we get into trouble. You gotta play by the rules. You got to do the right thing. If the law isn't where we want it, then we can work to change the law. I think the law is fine where it is. If we want some standards to increase, it's really between us and the carrier, to work amongst ourselves. We don't even need too many new rules by CMS. And so I found that very empowering to think about the fact that, the government and the entities are for the people and we are for the beneficiary. And so we can change rules, we can change laws, we have the power to do that. And so when I first started on this journey several years ago, I felt kind of oppressed and beaten up by it all. But now that I see how it really works, in any congressional district, for example, let's say there's 750,000 people, the votes are almost 50-50, right? There's just a small number of people that make a difference. And so if you have an issue, let it be heard. And of course, the midterms are coming up, so get out there and vote. Let your opinion be known. It's going to be a record time for our country. And that's empowering. That's empowering. And find your local congressperson. Let them know that you're a Medicare expert and you can help them as they help their constituents. So with that, I'll thank you for this week's edition. And again, new format next week. We're going to get a little more focused on a particular topic. That way people that can come in can get what they want out of it. As much as I like the conversation and the dialogue, which we'll still have some of, we see people asking for more focus and a little better understanding of what they're getting into. So thanks, everybody. Talk to you next week.